Hello, my name is Dr. Miriam Rahimian. I'm an internal medicine resident, PGY2, from Larkin Community Hospital from Miami. I'm going to present my case. The title of my case is Beyond Weight Loss, GLP-1 Associated Modulation of Compulsive Purchasing and Hoarding Behavior with Persistent Body Schema Distortion in a Mobility-Limited Patient. Background: glucagon-like peptide-1 receptor agonist, which is GLP-1 receptor agonists, including tirzepatide, are widely used for weight reduction and metabolic disease management. In addition to peripheral effects, emerging evidence highlights central nervous system activity, particularly modulation of mesolimbic reward pathway implicated in craving and compulsive behaviors. While reduction in food-related reward have been described, the impact of GLP-1 based therapies on non-food related compulsive behaviors and body schema adaptation remains incompletely characterized. The case of today: a 72-year-old female with morbid obesity with a peak of weight of around 400 pounds, wheelchair dependent at baseline but able to perform transfers, underwent sleeve gastrectomy in 2016 with reduction to 273 pounds, followed by an 8-year weight plateau. Tirzepatide was initiated in 2025, resulting in further weight reduction to 178 pounds. Her clinical course was notable for cholelithiasis requiring cholecystectomy, recurrent nephrolithiasis requiring lithotripsy, and urethral stenting, and multi-drug resistant urinary tract infection requiring IV antibiotics. Two clinically distinct but temporally associated phenomena were observed following initiation of tirzepatide. One was neurobehavioral modulation. This patient had a long-standing history of compulsive purchasing and hoarding behavior characterized by persistent urges to acquire and retain items. After initiation of tirzepatide, she reported marked attenuation of these urges with reduced acquisition behaviors and improved control, describing the effect as quieting of the internal noise. No concurrent psychiatric medication changes were identified in the interim. 2. Body schema disturbance. Despite substantial weight loss, this patient persistently perceived herself as significantly larger than her actual body size and demonstrated impaired spatial judgment during transfers. These findings were clinically consistent with impaired body schema, recalibration, and proprioceptive maladaptation in the setting of rapid weight loss and limited mobility. In discussion, GLP-1 receptor activity within mesolimbic pathways may reduce dopaminergic reward signaling, providing biologically plausible mechanism for attenuation of compulsive reward-driven behaviors extending beyond food-related domains. In contrast, rapid weight reduction, particularly in mobility-limited individuals, may outpace adaptive recalibration of internal body representation due to reduced sensory motor feedback, resulting in persistent body schema distortion. This case highlights divergent neuroadaptive responses in which reward circuitry modulation and perceptual body representation evolve through distinct mechanisms and timelines. In conclusion, this case demonstrates GLP-1 associated attenuation of compulsive purchasing behavior alongside persistent body schema maladaptation, suggesting differential central nervous system effects of incretin-based therapy. These findings underscore the importance of assessing neurobehavioral changes beyond weight loss alone and support the need for integrated behavioral and functional rehabilitation strategies in patients undergoing significant pharmacological weight reduction. Thank you very much for your consideration and listening to my poster presentation.